Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist at the Institute of Orthopedic Surgery. I want to talk to you today about a sciatic nerve block with a continuous infusion that has been ordered for you by your surgeon. Before we get started, I'd like to introduce you to members of the anesthesia team. You may have already met an SBA. An SBA is a special blocking assistant. She will be responsible for positioning, prepping, and assisting in the procedure. Her duties also include monitoring you before and after the procedure, and she will also help you with any discomfort that you might be having. Shortly, you'll meet an anesthesia provider. This is the person that will be taking you to the operating room and providing your anesthesia care. This may be a nurse anesthetist or another anesthesiologist. This procedure has been designed and all effort has been made to ensure your comfort and safety. The nerves to your foot are generally located behind the knee. This is where the block is performed. This is a very simple procedure. It will take less than 15 minutes to complete, and it will last up to 3 days. The block will decrease in intensity after approximately 24 hours. We call this a step-down or a step-down effect. We soup the block up today because this is a day when you're going to have the most pain. Some, but not all, of the feeling will return in the leg as well as movement in the next 24 hours. Be prepared for this as this is expected. You will be positioned with your tummy down for the procedure. The area will be prepped and draped like a little mini surgery. We will use an ultrasound probe that will be placed over the nerves behind your knee. The ultrasound probe machine allows us to see the nerves, which is extremely helpful. We will take a very small numbing needle, roughly the size of what a diabetic would give themselves an injection with, and I will numb up a small patch of skin about the size of a dime. I then take a special block needle, which is placed through the numb skin and is directed to the proper location. I will be watching this on my ultrasound machine. Your foot might twitch. We will tell you ahead of time if this is to be expected. Once the needle is in the correct location, medication is injected. A small piece of plastic tubing, which is about the size of a fishing line, it is hollow and has holes in the end of it, is passed through the needle and placed next to the nerves. You won't be able to feel me doing this. The skin is then sealed with a special glue after the needle is withdrawn. A pump is hooked to the tubing. A secure dressing is applied. Medication will infuse slowly around the nerves for the next 3 days. Remember, the block is stronger today than it will be the following days. Many of you will have a button on the pump that you can push to give yourself extra medication. Regarding pain medication, it's very important that you keep up with your pain medications both in the hospital and at home. You will receive specific recommendations at discharge. Removing of the block tube. This is a very simple procedure and is painless. We suggest that you do this procedure yourself. However, if you're uncomfortable doing this, you can call us and we'll be more than happy to remove it for you here at the hospital. However, if you decide to do it, again, it's very simple. You simply start at the end that is connected to the pump. You slowly remove the tape. You will notice a clear, crusty scab at the end where the tube goes into the skin. Pull gently outwards, verify that the tip is intact, and the pump tubing has been removed successfully. The area of the block is highlighted in the photo here. The area is the area in the orange and green. The blocked nerves do not go to the other side of the ankle or the inside of the ankle. You may have pain in these unblocked areas. If this is the case, pain medication will be provided for you. If this block works the way we expect it to do, you may wake up and not even know you have a foot. You might say, "Where is my foot?" You may initially notice extreme warmth, and then you may notice that your foot feels extremely heavy and you may be unable to move your foot. This is very common. You will likely wake up again and not even know that your foot is there. The extreme numbness and inability to move is usually significantly less the following day. Side effects can last 12 to 24 hours and up to 3 days, and include, again, extreme heaviness and weakness of your foot. Please use extreme caution with ambulation or moving about. You could fall with resultant injury. Again, I can't overemphasize to be very careful with your foot and leg. Again, use extreme caution with moving about. If you're in the hospital, make sure you call your nurse if you're going to get up and move. If you're at home or in the hospital, use your assistive devices as prescribed. At home, clear a safe path between your bed, the bathroom, the refrigerator, the television, etc. Wear your brace, splint, or cast as directed. The benefits of this block extend beyond going home and also include benefits here in the operating room. You generally will use less anesthesia and pain medications during your surgery. Many times you will wake up quicker with less nausea and vomiting. You'll generally be discharged out of the recovery room or be able to go home faster, and you will notice significantly less pain postoperatively. Anytime we put a needle in anybody for any reason at all, there is a small amount of risk. These risks include damage to surrounding structures, as well as risk from the medication. This is why we use an ultrasound machine, specially designed needles, special injection techniques, and we will monitor you during and after the procedure. A few housekeeping tips before we get started. Your guests and family members will be asked to exit the room. We will ask them to leave for about 15 minutes. You will notice we will bring in our equipment, which includes tables and an ultrasound machine. You will be hooked up to monitors. This includes EKG, finger clip, and blood pressure cuff. We understand if you're nervous. Most people are. It's not a problem. We're going to take great care of you. The best part is the nurse will generally provide you with a light dose of sedation. This is roughly equal to 2 drinks or 2 cocktails. This is generally given before your procedure and through your established IV. And by the way, if you have any questions about your block after it's in or any problems with your block, please don't hesitate to contact us. The phone number is on your handout. I will be coming into the room very shortly, and I'll be more than happy to answer any questions that you may have. I appreciate your attention, and I look forward to meeting you.